We've just finished the first meeting of the UK Faculty of Clinical Informatics. Over the next few weeks, we're going to run highlights for different sessions. For many people, it's not clear what's the difference between Nhs Digital and Nhsx. Will Monaghan, the Director of Operations at Nhsx, gave a very nice presentation about what happens behind the doors in his organization. You will see Professor Jonathan Kay, the chair of the Faculty of Clinical Informatics, having this exchange with Will. Let's watch.
Will, there's one NHSX and there's several hundred NHS organizations. If you've got a vision, how on earth can you make that bite when those organizations are being told, or were being told, to be independent and autonomous?
Yeah, so I mean, it is a challenge because we are a federated set of organizations that carry a single brand but behave and act in very different ways. But I do think fundamentally the NHS as a whole, well, I think fundamentally, centrally, we've got some levers that we can help use to sort of drive the right behaviors. So we've got some things around approving spend, around spreading best practice, around spreading innovation. And I do genuinely believe that people will tend to behave in operational management in hospitals in a rational way.
That was fascinating. Next, you will hear CMO at Ibm Watson. Mark has a very interesting career because he was a general practitioner, then he served in various leadership positions, including the medical director for Nhs Digital.
Jonathan, fantastic. Thank you for that kind introduction. I like the idea that I've emerged or re-emerged for me to be asked to do, because I have spent, many of you will know, 30 years working almost exclusively in health and social care. So when I joined IBM about 3 years ago, for me, it was completely fascinating to be in a room talking about financial services or I don't know, retail or transport, and to hear about their digital transformation. I honestly believe that in healthcare, we need to be humble enough to learn, but equally to hold tight to the things that make us unique. So there are certain values and realities around healthcare and social care which make us unique and make us sometimes digital transformation particularly difficult.
Our guest lecture was from the University of Newcastle. I was particularly interested in the focus of developing clinical decision systems for sepsis.
Introduction. I'm delighted to give the prestigious guest lecture today, and I want to talk about the work that we've undertaken here in the Northeast, especially at Newcastle University and Newcastle hospitals, to have a fantastic team around me. Big data in healthcare, we can pool it and we can analyze it, and everybody, they talk about these 3 V's. So it's got the variety, because we've lots of different data sources. It's got the volume, and also the velocity, so the speed at which these amounts of data can be accumulated and must be managed. So if we combine and we analyze these types of data, what we can do is we can predict certain developments or outcomes for patients. And let me give you, so we focused on sepsis. And the reason we chose sepsis was because, and the mortality rate is high and it's expensive. So almost half of the total cost of running an ICU. To ask was what if we could predict the likelihood of a patient developing infection and subsequent sepsis? This is before they've developed it. Because if we could do that, we'd be able to intervene earlier. We'd be able to reduce the cost because we're reducing, ICU admissions. We'd be able to integrate it with the CDS systems, so the clinical decision support systems, potentially flag patients who are at risk or at higher risk.
If you have specific questions or highlights, please contact the FCI via their website, and we'll look forward to your comments.